because time is also running out. We're going to go straight into the next session, which is question and answer. This session is meant to be very interactive. The speakers have had their position, and I saw people taking notes, so I want to believe that we also have people who want to either contribute or ask questions.
We need an orientation which will start from our Ministry of Health, Federal Ministry of Health, to the presidency. Because like what has been analyzed here, it's something that has to be taken from the home, family home, into society. I was a street child for close to 11 years in Nigeria. As a child, I can identify with all you said. I ran away from home at the age of 5. I survived till 11 years old on the street. That I didn't even want to go back home because that was my comfort, that was my zone. But eventually, when I went back home, I did receive the love. I'm here by just grace, God's grace. You know, whatever came out of me was not what parents, society gave to me. It was just a grace. So if this is going to work, you guys going to change your idea. It's not going to be going to Nigeria to go start a project, start an office, but force orientation. Go to the Ministry of Health. You have the embassy with you, that they can take you there. From the Minister of Health to the federal government, that we need an orientation agency to deal with mental issues in Nigeria. Thank
you. Just want to answer to this question or comment. Nigeria has to start from the very beginning, and this is what I wanted to tell. From baby care, from prenatal, because when you don't have enough food and care as a baby, then you are prone to become a criminal later in life. This is a susceptibility. Of course, we can't go there and give charity or something like that. This does not work. We have to empower the people, and the government have to give the possibility to empower the people. But this is what not happens, because the government holds everything for himself. And when we look at the life expectancy in Nigeria, it's far below 60, and in Delta State it's just about 50, and only the officials and the government have a normal life expectancy, so that is in Europe, because they took everything from the people. I have to tell this. Of course we have to go to the government, but it won't be easy, because they have to give away a lot of things.
Thank you.
All Nigerians that are here today, listening to your speech, I think I can even call myself as a medical doctor now. Why? Because you break it down. We don't need experts to do it, and we don't need our government to impart change, because this change will affect individuals. Because if you are going to government to give you license, they will cancel it. Minister of Health, they will not even allow you to bring such idea. What am I saying? In my own local area, where such cases are going on, we allow the churches, because the churches are rendering help. And out of that, some of these innocent people are being sold ignorant. And the government did not intervene or look at on this case of these people who are treating these people, because they are less privileged. They go out naked. So today, please, we form another step on our own. Thank God that our embassy have given us a green light that they will support. How will they support? We will start from Netherlands. Sunny is a group that God initiated in you. How do we impact it? Bring all Nigerians together. Give all this information. When you go to your village, see all those people. They are not people that we reject or neglect because of their situation. How can we change it? If we come now, you teach us the secret, how you can change it, not giving them the trust by step to step. We can learn it and we go back. There, the government will not give us the support, but we can also stand as a head, because anybody you help today is the best, because you don't know tomorrow. And I finish speaking to you now, tomorrow I'm dead. What is the legacy? view on this? Please, Mr. Sunny.
Most Nigerians who have the possibility, they leave the country. And some of them prefer going over the sea. They die there. And for them, this is better than to live in Nigeria, because there the possibility of life with human dignity is for 100 million people at the moment is not. So how to change this situation? The people should not leave the country. The intelligence should not leave the country. Why is there no mental health care? Because all psychiatrists work in the US, in the Netherlands, in the UK. We call this brain drain. And the situation has to be changed by the youth itself, not go away. It's like, how to say, we can't reset it, but we have to provide information.
Just to add to that, we're indeed a very small organization, just starting up, so there is, in as much as we want to do a lot, there's a limit to what we can also do. Therefore, we're planning a trip in the early part of next year, most preferably in January, to go to Nigeria. So what we intend to do is to start by carrying out some kind of enlightenment campaign on the people, to make them understand what mental health care is all about and how to identify that in our people, and then to change the orientation so that, and we want to do that as a community-based movement. You know, want to do that from the grassroots, visit the communities, talk to stakeholders, and then also work with civil society organizations like His Excellency just said, like the doctor in Abuja, you know, engage them, ask them questions about what are their challenges, and then see how we can, you know, look into their challenges, being the people living here and connecting minds like that of Mr. Willem. I can remember vividly in our first meeting with Mr. Willem, he already volunteered that, yes, we can clinic, can even take in 3 doctors from Nigeria to come and understudy what they're doing here in the Netherlands and probably take that knowledge back. While we do all of this grassroots community mobilization, information giving and all of that, we want to also engage people at the very highest level in the politics. So we're also looking at reaching out to people like the Minister of Health, and just like Pastor Evis rightly said, talk to some people within the presidency, give them the challenge and tell them what we expect from them, and then hopefully the outcome of such meeting can lead to some other things. Where we want to be hopeful, and we want to also ask for your support in all of us doing all of this, but be rest assured that whatever we're going to be doing is going to be out there in the public domain, and there will be room for everyone to bring in their contribution and all of that.
First of all, I want to appreciate being here today and thank the Comrade. It's a wonderful initiative. And being someone that has lived with somebody with mental challenges, I think I have a question for Dr. Ernst. William can also answer. But in the meantime, Sunny and friends, wonderful. Initiative is brilliant, it's about time. I think the problem we have in Nigeria anyhow when it comes to mental challenges is mindset. But my question is, mental health, does it really have a permanent cure? Or is it something you deal with for the rest of your life? Are there cure for it permanently? Or is it just temporary, just take your medication and that's it?
I consider myself still an addict, but I'm not using. But I have to be really careful that, at the moment I will take a substance or I will take a drink, and then there's a big chance that the motor is getting on again, and my body is wanting more and more, and then it's unstoppable. That's the character of an addict. It's never enough. So if it comes to addiction, you can absolutely stop using, stop drinking, and have a beautiful life. But for me personally, and I know millions of other people in the world, they still consider themselves as an addict, and which is okay, because you can have a beautiful life. When it comes to the serious disorders, mental health disorders, like psychosis, like you're saying, constantly depression, bipolar, or those are heavy disorders, and we know by fact that some of them will never come out of them. But also there, what we have seen the last 10 years is that most of them do get a normal life, and they are coping with the problems, the disorders they have. For the real psychosis, and maybe that's something you are talking about, I will like the doctor to answer that.
Yeah. There is not only one mental illness. There are a lot of different mental illnesses, and especially in countries where the life circumstances are bad, are not good, food bad, everything. The acute forms of psychosis are very high. What we see in the Western countries, more the chronic diseases. Both you can you can, as Jan Willem said, there is a disposition, yeah. But if in the acute psychosis you can heal, but then you stay still. In Netherlands they tell kwetsbaar, yeah.
Vulnerable.
Yeah, it's vulnerable, yes. But of course there are some forms of psychosis who never remit, but these are slowly proportioned. Most of them can improve a lot if you take care. If you take care of the people, not put them away. Yeah, if you shut them in a room, close everything because they are dangerous, yeah, they don't get better there. What a lot of people need, even if they are mentally disturbed for a moment, is care, connection. And what the healthcare system in the Western countries are doing, we have very sophisticated medication. It's good to help, but what they put away then is the care, because people need people. Everybody of us needs mental health because we need connection. We need to talk to each other. We need to have rules. We need to interact with. This is mental health. This we can provide. But what I want to say is that the mentally ill also needs a mental health surrounding, even if nobody understands him.
Can you give us some figures about the clients that remain clean after 5 to 10 years? Do you have can you give us a figure about that?
Yeah. We do the studies up to 2 years, because after 2 years, the response we're getting back is too little. After 2 years, it's still almost 35% which are getting back. And in, not my words, but scientifically, that's still a number which you can rely on, that's the whole population. So it's up to 2 years. Yeah, 40% of all the kids who went through the treatment that yes we can, they stay in recovery and they stay clean. 40%. There's 35% who relapse within the first 6 months, but they get back on track. So they relapse and they realize after a few weeks or whatever, and then they get back on track. The other percentage, that's almost the 25 to 30%, those are the ones who don't get it, and they are directly back into where they're coming from, and most of the times worse.
It wasn't really a question, it was just a recommendation for the work you are about to do in Africa, especially in Nigeria. But my concern is the sustainability, how you intend to sustain this. Like he rightly asked, he was asking William, thank you so much, thank you. He was rightly asking you that after they go through the treatment and everything,
how do you sustain? Do they get like completely healed, or do they fall back to the process? And then if they do, how do they get treated again? Because like what Sunny is going to do is really important. Like mental health issue is something that people don't really identify in. And if you look at it, I think in the world as well, everyone is suffering like a kind of mental health problem. But it depends to the degree at which they are suffering it. And then bringing that enlightenment to Nigeria especially is a great recommendation. So I just want to thank you for this privilege you want to bring it to Nigeria. But then, what is the sustainability? How do you intend to sustain this vision you're bringing to Nigeria? Thank you.
The thing I can do for this beautiful movement that they're starting now is to provide our knowledge to the people who want it, and maybe can bring it to Africa. And hopefully they will benefit of something. I understand completely that the differences between Africa and Europe are extreme. Yeah. What happened? What worked for me when I got back out of treatment, and when I got clean and sober, and my mind was at rest again, and I could start to live again, was that I needed people around me who've been through that same thing. So in the Netherlands, and also in all of Europe and in America, and I know also in Asia, you have fellowships. And fellowships are places where people can go to every night, and worldwide it's about 10 to 15 million people who do that, where people come together who experienced months or years of mental health problems or addictions. And they recovered, or they want to recover, and they come together to talk about it. Why? Because they understand each other. And it's really difficult to share sometimes your thoughts or the things you experience, or your behavior with people who have never experienced it. Those are the ones who will say, whoa, you're crazy. And that's exactly not what you need to know, need to hear. You need to hear from somebody who experienced it themselves as well. Say, hey, it's okay, it's just thoughts. You know, the only thing you don't have to do is act on it. So that is what helped for me enormously, that the people who got better, they stuck together, and they started their own movement, the fellowships, which is now worldwide more than 10 to 15 million people.
But what I think we want to start with our first trip to Nigeria is to see that in as much as we do the campaign at the grassroots level, community level, we also want to engage the government at the very highest level. And what we can do with that process is to see that sooner or later we can replicate, yes we can, as a sister organization in Nigeria using the PPP approach, public-private partnership arrangement, where we will bring all the stakeholders together to look at what it will cost to fund such a project. And then the goal of Yes We Can also be that they recruit some of the few doctors on the ground, and then bring in expert supervisors to supervise them. I'm not saying this is what we're, but this is, we just have to dream and see how we can get it. And then if we have this kind of institution in one location in Nigeria, screening people they take in, using the same model to clean people off their mental health cases, particularly in the area of addiction, then probably the government can then wake up to see how they can expand on that. Therefore, this can be like a pilot project where we can use it to show that it can also work in Nigeria. And then, of course, not only the federal government, probably state government and even private companies can see it as an initiative. Some of you may have seen the documentary on Dutch television yesterday. Such a situation, I mean, this kind of project can work in the Niger Delta region, where 6 states can come together. They have, like you said, the funds are there, the resources are there. If well managed, we can do much more than what even Jan Willem is doing here in the Netherlands. So I am very optimistic, and I believe this journey that has started small can snowball into, of course, Jan Willem was at this stage at one time where he had a dilemma of whether it was going to work or not, but he was pushed by his own personal situation to say, well, I don't really want to look at what the future will hold, but let me start to take a step. Let me start to take the step one after the other, and hopefully it can yield result, and it yielded results. So that is the power of positive thinking, and this is what we want to bring on board. Of course, we have to also appreciate at this point in time Dr. Ernst for his wonderful commitment. He single-handedly funded this conference to make sure it works. So I think we need to give him a round of applause for that. And I have never met anybody whose passion to see a new Africa. I've never met anybody like he is. I mean, he's very personal to me, and mutual respect, and I love what he's doing in Africa, and I'll continue to avail myself, my time, to see that how you want to see my continent become, that it becomes like that. And also, I'm just rounding up in the absence of no question, so we can also have some drinks. So also, Mr. Jan Willem, I want to appreciate you. I want to thank you for taking the time to come today to honor our invitation, and also for giving us the opportunity to look deep into what you're doing, where you're coming from. It has greatly inspired me, like I said, and I believe it has inspired many more people. And I can guarantee you that what looks like a small thing here today, I have put in the necessary, I've put in every necessary instrument in place to ensure that this outcome reaches out to those who truly and genuinely will make us together make a difference on this one. You will not leave without me giving the microphone to Ernst Fransek to probably give you a token of what he has for you in appreciation of your coming.
We thought that every speaker gets a present, and in normally a situation like this, we give some wine, some alcohol. Yeah? But I know that you are clean for 16 years now, and this is good to give Jan Willem an applause. Yeah, of course. So, I don't know what you are doing with the bottle of wine. I don't know what you are doing with the bottle of wine. Maybe this is a challenge for you, but you can give it to someone.
Give it away.
You give it away. Yes, I'm sure you give it away. Then when I was first time in Nigeria, Professor Akibe from the Benin Teaching Hospital gave me a statue. And I always thought this is just a touristic, but I know how perfect this has been made and how long the people work on it. And here you see women carrying water over kilometers to her children. And I thought this is a good present for you, because to carry water to the people is better than to put people in the water. So, Jan Willem, I think you should give it a special place. It's original.
Yes. Yeah. Okay. The embassy representative is gone, and yes. With this, we come to the end of today's event, and once again, I want to thank every one of you for taking the time to be here with us, and hopefully we want to make this event a yearly event, so where we will come together to also brief you what has happened in the last 365 days of the last time we had this. So we want to use it to personally challenge ourselves to make sure that when we get to that moment, we should be able to have something positive that is visible for all to see. So in spite of the corona, one of the speakers was supposed to be the Dutch member of parliament. She sent in a message this morning to say she's feeling cold and she wouldn't want to take the risk because she does not know what she is carrying. So we also have to respect people like that who decided that until they find out if they're fully okay, they wouldn't want to spread whatever the thing is that we are all scared of today. So once again, thank you very much. We've got wine, red and white wine, not for people who are still sobering, but those who can manage to at least take wine for the stomach's sake. So there'll be wine on the table, and feel free to network, and that brings this cutting to a close. Thank you all. God bless you. All right.